Scarring and neck lift. Hi, Dr. Dominic here at Elite Facial Plastic Surgery, and today I'm going to talk to you about the incisions involving a neck lift and prevention of scarring. Be sure to watch the whole video towards the end because I'll put some guidelines up that'll help you to prevent getting scarring or hyperpigmentation to your incisions as you're healing. With a neck lift, that incision is fairly small and it's normally going to be about this big and it tucks up underneath the chin. Everybody has a natural crease between the chin and the neck, and normally you can find that when you tilt your head down and up, and it's just a natural line that actually we all have. That's typically the area where I like to place the incision because, let's face it, it's already there. So the benefit of that is that once it heals up, it should barely be perceptible. And part of that reason is there shouldn't be much tension on that incision line. Ultimately, it will not be visible once you're healed. Now the key is that when you're healed, any incision you do on the body for the most part, especially in the head and neck area, it takes about 6 months to fully mature. I often recommend patients to make sure here in Florida where I am, to make sure you wear some sunscreen when you're outdoors and to also wear a hat when you're outdoors for an extended period. That really helps you prevent getting what's called hyperpigmentation or darkening the incision. The risk of getting any problems such as hypertrophy or, God forbid, keloid formation is just very unlikely in that area. But ultimately, when it does heal after 6 months, it's a barely perceptible incision. What are some of the factors that can affect the appearance of how the incision ultimately heals and try to prevent getting a visible scar? I think the most important thing is, number one, placement of the incision. As I said earlier, there's a natural crease that we all have between the chin and neck, and that's really important to take advantage of that in order to camouflage a scar when it heals. The other component is following your surgeon's recommendations regarding caring for it, and obviously not doing too much after the procedure. Give your body time to heal. The sutures are there to help approximate the skin and to give your body time to make scar tissue so that way the incision does not open. The other component is not leaving the sutures in for an extended period of time. And I would also recommend wearing sunscreen over the incision line if you're going to be outside for extended periods, and to wear a hat. The other adjunctive things that you can do if you'd like is placement of vitamin E oil, Mederma, and certainly silicone if desired. This brings me to talking about the timeline of the recovery after your neck lift procedure. So postoperatively, what can you expect? So normally the first day you're going to be wrapped up with what I call like a Cuban Q-tip, and you normally take that outer wrapping off after the procedure, but you're going to leave the elastic garment on that velcros on top of the head and behind the head. From the point of surgery to a week out when I see you back, that garment will stay on. For the most part, people are going to feel numb, it'll feel tight, which is totally normal. And then what happens is at your 1 week follow-up, we'll remove the sutures and we'll inspect the incision line and make sure things are healing up well. From that point moving forward, from 1 week to 2 weeks, that's when you'll start to notice a contraction phase in the neck skin. And at that point in time, you will start to get some contraction in the skin and the deeper tissues, and it will feel a little bit lumpy, bumpy. And it's usually at 2 weeks when I see you back that I start discussing massaging the neck area to help that firmness and unevenness settle out. From the 2 week period to about 4 to 6 weeks, that will be settling out. Usually by 3 months, the incision line is healing nicely. You still have a little bit of pinking, and then ultimately the firmness that you had should be pretty much resolved. Numbness and tingling should also be getting better as well. And then the next big stage is at 6 months. Usually things are mature, and the incision line at that point is fully mature, and you should have minimal, if any, visible evidence of that incision. I have a full playlist on neck lift, and I'm going to link it in the description. There's a lot of good information in there.